Okay, so welcome to the Department of Psychology at Bournemouth University. I'm Emily Arden-Close, and today I'm going to be talking to you about the MSc in Health Psychology. So I'm the program leader for the MSc in Health Psychology. Our course in particular has two main unique selling points. One is that it offers a life course approach to health psychology. This is a unique perspective on health psychology. And another is that we offer a placement. So that means you get a chance to do a week or more of work experience related to health psychology. So you will be taught by specialists in health psychology. So what is health psychology? Well, it covers two main areas. One is promoting health and well-being, and another is supporting people with chronic or long-term illnesses. Health psychologists might help people lose weight, stop smoking, eat more healthily, take more exercise. They also use their skills to improve the healthcare system. For example, they might advise doctors about the best way to communicate with patients. Our course is accredited by the British Psychological Society, and this is essential to be eligible for stage 2 training in health psychology, which would enable you to become a health psychologist. So I'm now going to talk to you a bit about the course structure. In semester 1, you take 3 courses. One is a core health psychology course in health-related cognitions, behaviours and beliefs, which looks at factors underlying health behaviours and how this can aid changes in attitudes, perceptions and behaviours to improve lifestyle. The other core health psychology course is called Stress and Developmental Influences on Health and Illness, and that looks at the role of stress in physical health and well-being and the role of developmental influences on health. The third course you take in first semester is Advanced Research Methods, which introduces you to qualitative research methods and a range of research methods for data collection that will be of relevance in your future career as a health psychologist or conducting health psychology research. In semester 2, there's one core health psychology course titled Experience of Chronic Illness and the Delivery of Healthcare, which looks at key factors in adjustment to chronic illness and the delivery of healthcare. There's also a course on key transferable skills, which teaches you skills such as writing papers, writing grants, time management, all skills that are useful in future research or professional practice. The third course you'll take in second semester is Advanced Statistics, and don't panic, we provide a lot of support with statistics. There are workshops as well as lectures. The other course is the project, which you're going to be working on all of the year, but you submit at the end of August. You have a few months to work on your project after your talk components are complete, and this provides an opportunity for you to conduct in-depth research on an area of interest using the research method skills that you've learned in advanced research methods and advanced statistics. This is also when you'll carry out your placement, which I'll talk about a bit more later. It can be for a week or more. Most people prefer to spend longer time, but a week is the minimum. So the placement is a great opportunity. This is something that's not offered by every health psychology course in the country. It will give you the opportunity to gain valuable professional experience, which will give you a competitive edge in finding jobs after graduation. It also teaches reflective practice skills, which would be essential if you wanted to go on to either stage 2 training in health psychology or maybe a doctorate in clinical psychology. So we, the placement unit leaders, will prepare you for the placement. We set up a range of relevant placements based on your interests and what is available. We provide a range of lectures to prepare you for the placement. We provide support to you during the placement, and we provide coursework guidance and manage student feedback. So what are the placement options? Well, you could do a clinical placement at a local hospital or healthcare service, or alternatively, you could do a research placement with a member of staff, usually at Bournemouth University. Examples of possible placements include, maybe we've got a student at the moment working with the eating disorder service at Poole Hospital. There's opportunities to work in long-term conditions aspect of improving access to psychological therapies. There's also opportunity to work in health behaviour change with the local council, or to work as a research assistant with one of the members of staff in the department who does health psychology related research. So how is the course assessed? Well, core health psychology units are assessed by coursework, assignments and exams. Coursework would typically comprise a variety of assessments, maybe essays, presentations and papers. And the research methods units are assessed by 100% coursework, as is the project. At Bournemouth University, in general, we have a focus on fusion. We try to fuse research and professional practice with our teaching to enhance the student experience. So, for example, some of the lectures on chronic illness and delivery of healthcare are delivered by members of external individuals who are maybe working at a local hospital with a particular population with chronic illness. What support systems and opportunities do we have for our students? Well, in course, we have a range of student support. You'll be based in Poole House, which are pictured on the right. There's a very good staff to student ratio. We have you will be assigned an academic advisor to provide pastoral support. And their academic advisor has regular office hours, 3 hours per week, when they're in their office, and you can knock on their door and go and see them. You can also go and knock on staff doors if they're in their office and not in a meeting at any time, even if it's not their office hours. So we're always available for you. Well, what about the facilities we offer? Our psychology department has 3 dedicated computer labs. We have teaching rooms that are used for seminars, research methods and statistics. A lot of the teaching rooms used for research methods and statistics will have computers on them, so you can work on statistics exercises on a computer. Other facilities we have include a one-way mirror, research labs, an EEG machine, eye tracking, a virtual reality lab, and transcranial magnetic stimulation. We use a range of specialist resources and materials in the course, such as psychometric tests, Mentimeter and online survey platforms. What facilities are there at Bournemouth University? Well, there's a range of learning and study spaces. Bournemouth University has a range of computers that are available to students on campus 24 hours a day, 7 days a week. Psychology is based on Talbot campus, which is a couple of miles from the centre of Bournemouth, and we are expecting some new facilities shortly. What student support is provided at the university level? Well, we have academic support. There's the disability and additional learning service where you can go to if you feel you need extra support with your assignments, and you suspect that might be something that you would benefit from. We have a language centre. We have a library and learning support. We provide study support. There are workshops to help with things like academic writing, revision techniques, referencing, critical thinking, time management, and statistics, which a lot of MSc students find helpful. We have careers fairs. So we have annual careers fairs and a workshop where you can meet potential employers. Moving on to more broader support that's not related directly to academics. We have a multi-faith chaplaincy, we have a counselling service, we have a medical centre, and we provide mental health support for individuals. We're very active in reducing stigma around mental health. There's also our Students' Union, which provides support with student life. It has student representatives, so every master's course, including the MSc in Health Psychology, has a representative. If we have more students, it would have more representatives. And there's opportunities to volunteer within the Students' Union. So moving on, what about careers in health psychology? To become a chartered member of the British Psychological Society and a full member of the Division of Health Psychology, you need to complete one of the following qualifications after the Stage 1 MSc in Health Psychology. Either the BPS qualification in health psychology, a BPS accredited doctorate in health psychology, or a PhD in health psychology. Details about Stage 2 can be found on the careers section of the British Psychological Society website. Other options include a health-related post in a medical or research setting, or a doctorate in clinical psychology. But if you wanted to go onto either Stage 2 training in health psychology or a doctorate in clinical psychology, you would usually require a 2-1 at undergraduate level. So what are entry requirements? It's essential to have a degree in psychology with a minimum of 2-2. It's really important. This course does involve complex psychological concepts, and you do need to deal with some quite complex statistics. So it's important you feel able to cope with the course. And if English is not your first language, you must have IELTS. Going to talk now a bit about Bournemouth and the local area. So Bournemouth is famous for its 7-mile stretch of award-winning sandy beaches and was one of the most stunning coastal towns in the UK. It offers beaches, a town centre, a state-of-the-art leisure complex, and stunning green spaces. The New Forest National Park is on our doorstep, and the Jurassic Coast, which is a World Heritage Site, is a short drive or bus ride away. We're less than 2 hours from London with direct trains to Waterloo, and we have an international airport. Thank you. Here's where you can find us. And for any further course-related questions, you can email me, Emily Arden-Close, on eardenclose@bournemouth.ac.uk. If you have any general queries about the university, please email Bournemouth University at futurestudents@bournemouth.ac.uk. Thank you for listening.